Hi there, ladies. I am Jen Lormond, exercise physiologist, mom of 3, co-owner of Tighten Your Tinkler.
I'm Christina Walsh, physical therapist, mom of 2, and co-owner of Tighten Your Tinkler. And it's Bladder Health Month.
Woo, woo.
We get to talk about pee with you for the whole month of November. Try not to get too excited. But seriously, this stuff is way more complicated than usually anyone is telling you. And we want to break down some of it in a digestible way, but also in a way that gives you the power of all the information that you might need to advocate for yourself and get the care that you deserve.
So just like our prolapse video that we've done, kind of breaking down and explaining the different types of prolapse for you, we're going to try to do that today with the different types of incontinence. We're not going to do a deep dive. We don't claim to be urologist or urogynecologist, just trying to take some of this information and break it down in a way that makes sense. And we're going to start with just general bladder function and what the norms are there.
So the pee is made up in your kidneys, which are actually near your back, way up near the back of your rib cage, believe it or not. And then the pee goes through little tubes called ureters all the way down to your bladder. And as your bladder fills, let's give you some perspective of a visual. Now this view is like, cut you in half and look at it from the side at the center of your body. You've probably seen this before. It's one of our favorite pictures. Here's your pubic bone, that hard part at the front of your pelvis. There's your bladder. So it's nestled way down in the pelvis. Uterus kind of sits nicely on top when everything's in the right place. And there's the bowel, the rectum. So bladder right here is what we're focusing on right now. And as it fills with urine, it has to grow. And as it fills, it lifts up a little bit out of the pelvis to allow room to fill, much like the uterus lifts way up out of deep in the pelvis as it grows a baby. So the bladder also lifts up and out as it fills. And normal bladder capacity is 16 to 24 ounces of urine. And then your body tells you, oh my gosh, I need to pee as it fills. And if none of this is in trouble or not working right, you sit down the potty, you relax all the muscles down here. And that's both sphincters. You have an internal sphincter and an external sphincter. That's the little muscles that hold the pee in when you don't want it to come out. They relax with you relaxing your pelvic muscles, and all the pee empties out. And ideally, all of the pee empties out, so you don't have to go again quickly thereafter. That is how normal bladder health should work. Anything to add, partner?
That was excellent, incredibly thorough. So we just felt like a lot of women get confused as to how all of those things relate. So hopefully that helps give you greater context of normal bladder function.
And sometimes things don't go well. That whole system and area of our body is under a lot of stress through pregnancy and childbirth. Things get stretched, pushed, moved, sometimes don't quite go back where they were originally. And that's where bladder dysfunction, pee problems come in. And there's different types. This is probably way more complicated than anyone has explained to you before. And we're not telling you that to overwhelm you, but to empower you with knowledge, because the more you understand, the better questions you can ask, the better you can advocate for yourself to get the care that you need, because not all bladder issues are created equal.
And you can select the right tools to then help, because that is part of our mission, is not to just give you information about the problem, but also try to give you some tools for improving that problem, which we will talk about at the end of the video. So hang with us. Let's talk about the two most common ones that most women are aware of, which is stress urinary incontinence and urgency urinary incontinence, and some of the differences between them. That's the most common things that we hear about with the women we work with. And that's because the stress urinary incontinence is really created due to an increase in abdominal pressure, which again, if you look at this, that makes sense, because as this is all trying to raise up, it decreases the space in the abdominal cavity. And if you have weak pelvic bowl muscles or pelvic floor muscles, this helps regulate abdominal pressure.
So if you laugh, cough, sneeze, or jump and you leak urine, you have stress incontinence, because laughing, coughing, sneezing, and jumping increase pressure in this whole area of the body, the abdominal and pelvic cavity, which puts pressure on bladder. And if you don't have the support underneath here to hold it all in when the pressure up here increases. It's like, I love Jen talks about squeezing the toothpaste tube. And if it's almost like if your pelvic floor isn't working real well for you and you increase pressure up top, it's like squeezing the toothpaste tube without the cap on.
It's got to come out.
And it's going to come out. And that is stress urinary incontinence, that laugh, cough, sneeze, jump, and pee situation. But there are 3 other types.
Surprisingly. And the urgency, you know, typically most women have both of those. I would say the urgency with the stress. The urgency feels like you didn't have to use the restroom. All of a sudden you feel like you really have to go and you have to get to the restroom quickly. Otherwise you're going to have an accident. And that's really just involuntary contraction of the bladder, which causes the leakage. And that's due to more of the sphincters.
And so that's the gotta go now, and like can't get there fast enough. That is that type of incontinence, that type of leakage. There's also neurogenic bladder or neurogenic incontinence. So bladder is so complex, you guys. Needing to pee and peeing at the right time is all a complex process. The bladder has nerves that help control it, both from the conscious and the unconscious part of our nervous system. So the conscious part of our nervous system that innervates or helps control the bladder is the part that because it's a conscious activity, hopefully it's a conscious activity to let the pee out. And that's the part that's controlled by those conscious nerves. There's also a subconscious part of our nervous system. That's where the fight or flight system is. That's the, I startled or scared so much I peed in my pants. And that's also why there's a big anxiety component wrapped into bladder health and bladder emptying and pee function, because that fight or flight system plays a role in and with bladder function. So believe it or not, getting out of fight or flight is important for bladder health. I mean, it's fascinating. If you're a little bit nerds like us, you want to know this information, but you should want to know because it's actually going to help you in the end. So neurogenic bladder is dysfunction of the nerves. The nerves, exactly, which is a complex system, as we talked about. There's conscious nerves and there's subconscious nerves that all play a role in how this stuff works.
And so one of the ways that you could help yourself if you've been told that maybe you have overactive bladder, which is something else that this particular thing is called rather, you could utilize our 90-90 decompression, which we talk a lot about for back and hip discomfort, but that 90-90 also does a great job of decompressing your vagal nerve, which controls fight or flight. It regulates whether or not you're in that rest and digest or fight or flight. Yeah. You want to be more in that rest or digest. So elevating your legs, as we show in that 90-90 above your heart, is a vagal decompression, and it's going to alleviate anxiety and that fight or flight system. So we'll drop that in the comments below.
Actually help the neural piece of bladder dysfunction. So cool, right? Like knock out a whole lot of things all with one technique. You have personal experience with this one.
This is overflow incontinence, and this is really a blockage in the tube that you pee out of that causes this.
So this is similar to the view we just showed in the textbook. This is from the side. The little red is bladder, yellow is uterus, green is rectum, and this is the pre-baby situation. And then, as you know, Jen is living with prolapse of all 3 compartments, which means, so here's where bladder ideally is, and you see this nice little tube here. This is where the pee is supposed to pass out of, this red line. And what happens when there's prolapse, specifically of the bladder or cystocele, is the bladder's kind of fallen back and down. And where is that tube? Where is that nice little line that's straight and open and unencumbered? It's kind of not there. It's kinked, it's smushed, it's pulled on, it's crooked. And that is a blockage of the passage the pee needs to take to get out of the body. And that's what this last type of incontinence is about. And we have some tools in our program that help relieve that, and that we've taught, and that Jen uses.
Life changing.
It's a kink in the hose, as she calls it, is what it feels like.
And that's what it feels like. Like if you were to step on a garden hose, you know that you have to go. There's pressure building there, and then you change your position. Like what used to happen to me is I would just either lean over or change position and I would have leakage. And that's the overflow incontinence, because that change in position would then alleviate some of that pressure and that kink in the hose, and then whoop, you know, hello,
There it
surprise.
goes. Because it was full and it was ready to come out. And even though she could feel that, she wasn't able to empty because of that kink. I mean, you know what happens to a garden hose, get that twist, ain't nothing coming out. So that's what all this stuff feels like. And it is complex. And if you're dealing with some of these bladder issues, it leads to not being able to get all the pee out when you do need to pee, which can lead to much more severe issues like recurrent chronic UTIs. And then those can even progress further up the chain of the urinary system up into bladder infections and kidney infections. So this stuff can be a really big deal. Please seek help from a physician diagnosis if you're dealing with any of this stuff. And if you have that stress incontinence, our program will fix it with no Kegels and no sit-ups required. That is what we know for sure because the research proved it, on top of all the anecdotes and personal experience that we have behind that. But we encourage you to seek care and seek help for this stuff because it can get into more progressed problems, and it's not going to get any better as you get older. That's the other thing. If you think it's going to get better,
something that just goes away. I really wish it did.
It's not.
Denial is not a good thing.
It's not. So if you're having a little bit of leakage now and you're like, maybe it'll get better, it's not bad enough that you really want to do anything about it. Just remember us and call us when it does get worse, because we'll still be here talking about pee and poo and pelvises, and we'll be ready to help.
And that being said, we would love if you do have specific questions about your case, or you're looking for a referral. A urologist is a great place to start. Urogynecologist is the place to start. If you're feeling pressure, discomforts, and suspect prolapse, a urogynecologist is going to be the place that you want to go. With the bladder stuff, your OBGYN is not really, that is not their specialty, but they can certainly refer you to a urologist or a urogynecologist.
Yep. And sometimes accepting some pharmaceutical help for some of these situations, especially initially, is appropriate. What we hope for women is that you don't feel like you have to rely on that stuff in the long term.
I can tell you that I did rely on pharmaceuticals because with this particular situation, I had some really, really severe bladder infections where I was bleeding as if, maybe some of you can relate, bleeding as if I had a period from that infection. And I needed a way to make my life a little bit better in the interim while working on some of that musculature support. So we are not anti-medication all the way, especially if it's a bridge to getting better.
Yep. It is in essence a Band-Aid. So for us, we want to fix it at the root. We want to get better and get over it and get past it and not have to rely on that medicine forever. But there is a time and a place where putting a Band-Aid on like that while you're building strength and adding that up and in support to lift and give those organs what they need is appropriate sometimes.
Reach out with your questions, ladies. We are here. Our hearts are in this. We are personally invested in your results and want you to feel your best.